My name's Dr. Isabel Adeyemi, and I am a research associate in the Greater Manchester Patient Safety Translational Research Centre. And I also work in the Centre for Primary Care and Health Services at the University of Manchester, where I coordinate a PPI panel called PRIMER. And in this presentation, I'm going to tell you more about PRIMER and the work that we do. Before I go into the presentation, I just wanted to let you know about how this presentation will go. So I will speak for just a few minutes to introduce PRIMER and what PRIMER is. And then I will play a video. There'll be another video, and it'll be a case example of a PRIMER member called Lindsey Brown and a researcher at the Centre for Primary Care and Health Services Research called Dr. McMillan. And together they'll be talking about the work that they've done working on a research study in the centre. So this will give you a flavour of the input that PRIMER members can have in the centre. And lastly, I will then give a really brief talk about how PRIMER has continued to stay connected during the COVID-19 pandemic and what we've learned from it and how we hope to evolve. So just to start off with, I'll talk a bit about what PRIMER is and who are PRIMER members. So PRIMER is a PPI panel in the Centre for Primary Care and Health Services Research at the University of Manchester. It was set up over 10 years ago, so it's a long-standing group. It's a group of individuals who have a common interest in clinical research within the primary care health sector. So what this means is that PRIMER members, for example, have recent experience with primary care health services, such as GP practices, community pharmacists, dental practices. There are 12 core PRIMER members, and they meet every 6 weeks. And on top of that, there's 10 corresponding members. And these are members who don't attend meetings, but who send written feedback by email about research being developed in the centre. PRIMER support the development of new research ideas in the centre, and they provide input in how research is carried out and disseminated. And in addition to the regular PRIMER meetings, PRIMER members can work alongside researchers more closely to develop research studies. So this leads me on to the video. And in this video, Brian and Lindsey talk about their experiences of working on a research concept through to the development of the study, the findings of the study, and to working together on a write-up of the study's findings.
Hello, I'm Brian McMillan. I'm a GP in Sheffield, and I'm a researcher at the Centre for Primary Care and Health Services Research at the University of Manchester. I'm just going to talk a little bit about some research I've done looking at what patients want from online access to their primary care record. The UK government are keen that patients are able to access their health record from home online, and that's something that is now actually part of the GP contract, so GPs should be offering patients this service. There's been quite a lot of research that's been done looking at the benefits of letting patients access their health records from home, and it has been shown to be beneficial both for patients and for clinicians and primary care staff. There's also been a fair bit of research looking at what patients do when you give them access to their records, but not much work has been done looking at what patients want to be able to do, so the kind of features and functions that patients would like to see. And this is something that I'm interested in, and something that PRIMER has helped me look at in more detail. I first got interested in this topic through my work as a GP. So during consultations I could see how turning the screen around to show a patient what was in their record, it really transformed the nature of the consultation. It went from a patient sitting in front of me telling me their problems while I tried to come up with solutions, to a situation where the patient and I were sitting side by side, looking at the problem together and trying to come up with solutions together. So it was really transformational. My role in the project was to come up with the idea, design the study, apply for funding. Once funding was received, to apply for ethics approval, and then to run the study, gather the data, analyse that data and write up the findings for publication. But I didn't do these things on my own.
I'm Lindsey Brown. I've been a Primer member for around 5 years, and outside of meetings I work alongside researchers to give a public perspective on some of their research, right from the initial research question through to what's the best way to present those findings to the public. I'm going to talk to you today about some of the work I've been doing with Brian at some of those key stages. Brian's research really struck a chord. I'd only found out a few years earlier that you could access your medical records online, and I knew that how much access you got really varied from practice to practice. Personally, I think that giving people access to their medical records could solve a lot of problems, but I can see that it could also cause some problems if it's not done in the right way. And I really liked Brian's approach, the idea of going out and finding out what patients want to be able to access, what they'll use that information for, and what concerns they have seem really essential, rather than just basing it on what practices thought people would want. So I was really excited to get involved.
So the patient and public contributors have really helped at every stage of this project. Right at the very beginning, I went along to a Primer meeting and discussed what I wanted to do. Primer raised some really interesting suggestions. So for example, they suggested I might want to include carers in my symbol, and that wasn't something I'd thought of, but it's something I did, and I think that the project has really benefited from that. They also made some really useful suggestions, such as ensuring that people that have not had much experience with using computers were included in the project as well. So Primer helped me write the funding application. They helped especially with the wording of the plain English summary to make sure that it was very clear and easy to understand. And that funding application was successful. Once we'd received the funding, 2 Primer members joined the project and helped with various stages of the project itself. Then the next step was to write the study up for publication, and again the 2 Primer members helped with that, and they are co-authors on a paper that has recently been accepted into BMJ Open. Once the study had been written up, the next step was then to go on to apply for some further funding to take the project forward, and again Primer has helped with this, with things like the plain English summary and with the design of the study itself. The biggest thing I've got from working with Primer is that it's helped me keep my feet in the ground, and it's helped me keep focused on the fact that the reason I'm doing this research is ultimately to benefit patients and to help them lead healthier lives.
After Brian came along to a Primer meeting, I volunteered to work with him on his project. Initially, that involved going through his plain English summary and giving feedback. So that his plain English summary, that's like a version of a research application that's written in a language that the general public should be able to understand. And giving feedback usually involves things like highlighting things I don't know, raising potential concerns, asking questions, or even suggesting some rephrasing of certain sections to make them easier for people who know nothing about research to understand what he's planning to do. After all the interviews with patients and focus groups had been carried out, the researchers grouped the findings by type. So, for example, some people were saying they didn't even know that they could have access to their medical records, or that they'd like to be able to order prescriptions online, or that they thought having access would resolve some of the problems they faced when they have hospital appointments at trusts who don't have access to their full record. And after that, the researchers then needed to be able to group and present everything they'd found out in a way that would be helpful, but that would truly reflect the points that had been made. So at that stage, another Primer member and I attended 2 workshops along with 2 researchers to try and work through that process. We did that using something called a Ketso kit. So that's a bit like writing lots of things on lots of different pieces of paper and moving them around the table until you're kind of happy with the groupings and the structure you've come up with. And part of the reason that we did that is because grouping people's answers and working out how you're going to present answers, it's really difficult to do that without putting your own personal translation onto things. And so by having 2 researchers and 2 members of the public, you kind of had a range of different perspectives there to make sure that that was balanced. After the 2 workshops, Brian then wrote up a paper, his first draft of a paper for publication, and the other Primer member and myself were asked to give feedback on it. And that was very much like giving feedback on a plain English summary, in that we were looking at both the language and the content. So we were looking at things like, did it match up with our understanding of the points that had been made? Did we feel the key messages were fairly represented? Did we feel that the recommendations that were being made would resolve the problems that have been raised? At the end of the research, Brian then asked if we would be interested in carrying on working with him on his next piece of research, which links into this one. So we then started the process all over again, giving feedback on his lay summary, and hopefully in the next few weeks we'll start working on the next stage of the project.
So I hope that video gave a flavor of how Primer members can work with researchers more closely on specific projects, and the input that they can have on that project. In this last video, I want to talk a bit about how Primer has continued their work throughout the COVID-19 pandemic and how we hope to evolve. So before the pandemic, corresponding members could provide their feedback by email, but core members usually met face-to-face. And bearing in mind, Primer was set up over 10 years ago. Adapting to online meetings was in fact one of the biggest changes for Primer during the pandemic. In terms of how Primer hopes to evolve, staying connected during the COVID-19 pandemic has provided a learning opportunity for Primer to find practical ways of diversifying membership. Primer members are from a range of ethnicities, cultures, and there are different ages as well. However, as a group, Primer has highlighted the need to be more inclusive of adults of working age and who are in employment. During the pandemic, Primer branched out to network with employers for how to engage with employers and employees about public involvement work. So we wanted to see if we could model public involvement meetings in the way the School Governors Program works. So for the School Governors Program, employers enable their employees to be a school governor by giving them time during working hours to attend the school governor meetings. From our experience of both working remotely during the pandemic and from the conversations we've had with employers, we learned that online meetings can provide extra choice for how people can attend Primer meetings. Online meetings may be beneficial for adults in full-time or part-time employment to reduce their travel time and any disruption they may have in attending Primer meetings on their scheduled day. Speaking to employers, however, we also realized that outside of academic circles, public involvement in research and its value is not well understood. So from this learning, Primer has produced some videos to explain more about what Primer is and to promote the work that they do in the Centre for Primary Care and Health Services Research. We've also recruited a new Primer member over the last few months who is an employer, and hopefully the idea is that we also want to further discuss how to support adults in full-time and part-time employment to be part of Primer. If you would like to know more about Primer, I will be tweeting links to the videos if anyone wants to watch them. I will put my Twitter details in the chats. Thank you very much for listening.